ADHD children often have what I call an emotional-based reason why they have that diagnosis. What I mean by emotional-based is sometimes they have experiences in their past that have traumatized them. And those traumatized experiences are things that create their acting out and their inability to concentrate. This is depicted in a case that I worked with of a boy that came to me when he was 9 years old. His parents were divorced. His father had custody of him, and he was 1 year below grade level. He was not concentrating in school, really hard to sit down and do his homework. He was just very agitated, very angry boy, couldn't sit still. His parents, when they were together, his biological mother and his father, often fought. And they did that when he was a little boy. In the course of the therapy that I worked with him, we found that this experience of having his parents fight was very traumatic for him. He also, we discovered in the course of our work together, had been abused by his biological mother. She no longer had custody of him. Father had full custody, and child reports were made. However, in the work, we found that his mother had beat him with a belt. He had welts. He tried to run away when he's 3 years old, ran out the window and went to his grandparents' house, of course, not far. She did a lot of other very serious kinds of abusive experiences with him, and a lot of these he had repressed. He didn't want to talk about them. He didn't even think they existed. But as we worked, we found that she actually had, at one point, threatened him with a knife and that she was going to kill him. This woman obviously had some mental health problems and had taken it out on her son. The work for him was difficult because he had to relive these experiences. But when I work with children, I develop a relationship with them. That's a relationship of trust, a relationship of safety. So when they are going into deep, dark places like this, they know that I am with them, that I am supporting them, and then they can get through it. Not only was he able to go through these experiences, which also included an emergency C-section birth where he almost died. His mother was in great distress, and also an experience of his mother not wanting him as a baby. So it was a series of issues that had created a sense of him where he didn't even want to live. When you work with children that have been traumatized, always the center point of any work in therapy is to make sure you go to the point where they are afraid that they died. This is where he came to when his mother was threatening him with a knife and the birth. Once he worked through those experiences with regression therapy, which is the technique that I use, he moved to being able to concentrate in school, have straight A's, and be the president of his student body. He was able to continue his sport, which was ice hockey, and to feel confident with that sport, which he had previously had difficulty with, not as far as his skill level, but as a feeling of self-confidence and breaking down. He had a tendency to become very emotional and upset, which is what children do when they are in stressful situations. And he was trying to perform in his sport. I hope that you found this helpful and that you will visit my website, subscribe to my channel, and if you have any questions, please email. I will be happy to answer them for you. Thank you.